Welcome to Snackable Health with Dr. Gibson and Dr. Kohli. We're talking about the safety of exercise. A lot of concern out there, a pile after the Sex in the City episode with the Peloton. Is it safe to exercise?
You know, a lot of my patients are asking me this, Mike, because people worry that they're going to have a heart attack on a treadmill or an exercise bike. So let's talk about exercise. When you exercise, you do increase the amount of blood flow that the heart needs. So it is possible that if you're on the brink of having a heart attack, you potentially could precipitate the heart attack during exercise. But remember, the exercise didn't cause the heart attack. It's your risk factors, your underlying health conditions, and those are the ones that you want to try to modify. And instead, we know, Mike, that exercise in the long term releases chemicals that are healthy for your blood vessels. It lowers your resting heart rate, lowers your blood pressure, keeps a healthy weight. So exercise is really a good thing. But before you dive into that swimming pool, you want to make sure you talk to your doctor about what is a safe way for you to exercise.
That's a great point. And, what are some of the things that you can do to improve, your exercise tolerance?
So I like to say that instead of cannonballing into the swimming pool, you want to really step in one toe at a time. So one of the best ways to improve your exercise tolerance is to slowly push that envelope. So start with 5 minutes a day, which all of us can handle, and then increase that in increments of 3 to 5 minutes every week. So the next week you're doing 10, the next week you're doing 15. You really want to get up to that 30 minutes for at least 5 days a week where you're getting that heart rate up. One thing I'll add, Mike, is that when you're on that Peloton or the treadmill and something doesn't feel right, don't just chalk it up to deconditioning or being out of shape. If something feels wrong, you want to be sure to stop and make sure you get it checked out, especially if there's symptoms that are very unusual for you.
Thanks, Bob.